I remind everyone to please post your questions into the Q&A. You have a good chance to ask these experts some pertinent questions. Our next speaker is Claire Sparke. Claire is the Unit Head Population Health at Australian Institute of Health and Welfare, and her role involves managing improvements in population health information, including monitoring and reporting on risk factors for health, including environmental determinants. And you're about to hear about bushfires. Thanks, Claire.
Thank you. Just share my screen. Afternoon, everybody. My name's Claire. I head up the Population Health Unit at the Australian Institute of Health and Welfare. And for those of you that aren't aware, we're a statutory government organisation providing statistics on health and welfare topics. I'm going to talk to you about some work we've done on the short-term health impacts of the Black Summer Australian bushfires 2019-20. And I'd just like to acknowledge that this work was partially funded by the Australian Government Department of Agriculture, Water and the Environment, and the New South Wales Department of Planning, Industry and the Environment provided us with air quality data. Before I start, I'd also like to acknowledge the traditional custodians on the land upon which we meet. I'm in ACT, so this is the Ngunnawal people. I'd like to pay my respects to elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people who are present today. So I think the previous speakers have acknowledged this quite clearly, but with climate change, Australia is seeing an increase in extreme fire weather. The trend is predicted to continue as temperatures rise, and in the bushfires of 1920 were the worst on record in Australia in terms of their scale and intensity. 33 people lost their lives and over 3,000 houses were destroyed. And bushfires can be associated with a range of health issues, both short-term and long-term. In the short term, generally we've been looking at respiratory health, cardiovascular and mental health. But public health facilities can also be affected. There can be impact on water supplies, destruction of major infrastructure, and hospitals or hospital equipment may also be affected by bushfire smoke, as we saw in these fires. So our main aim of this project was to, using the data we had access to, assess what we could on the short-term health impacts. So in addition to a print report, we released online interactive data tables and maps which displayed health data alongside air quality data. And these can all be found on our website. We wanted to look at each week and at small areas as possible. So we used data from emergency departments, as well as MBS and PBS over-the-counter sales data and deaths data to do this. For our first release, we were able to get expedited emergency department data from New South Wales, and we've since updated that for all jurisdictions, and we've also included admitted patient information in hospitals. So the literature has documented the relationship between bushfire smoke and a range of health conditions, as I previously said. In this presentation, because we're looking at mainly short-term impacts, I'm just going to focus on the respiratory health, because that has the strongest link between bushfire smoke and short-term adverse outcomes. And when we've done this, we've looked at a comparison between the week in a bushfire period and for emergency department visits the same week in the previous year, and for hospital data, a 5-year average. So I'm just up here are a couple of examples of what happened during the bushfires. So in Victoria, in the week beginning the 12th of January, we saw an increase of 125% on the rate of asthma presentations to emergency departments, or 485 presentations compared with 215 the previous year. Another example from New South Wales for COPD, we saw an increase of 57% in the rate of COPD admissions, or around 185 hospitalisations compared with around 110 across the 5-year average. We also saw an increase in sales in bushfire affected areas of inhalers for shortness of breath. So for example, you can see here in the ACT, between the week of the 5th and the 11th of January, there was a 204% increase. And in the Latrobe Gippsland region, there was a 53% increase. We overlaid this data on PBS prescriptions and sales of inhalers with air quality data where we could. Air quality data isn't available for every region, but this is an example of the ACT where you can see the increase in sales or prescriptions, sorry, in this one of scripts for respiratory health as PM2.5 increased. So although I've just focused on respiratory health, we did look at other areas using the data that we had access to. So the government at this time introduced bushfire-specific mental health items. So we tracked these across time and noticed that by about middle of last year, there were around 500 to 600 services per week, but that had dropped off by about half by February this year. It was really difficult to track because of COVID, obviously, that there were lots of other mental health items that people can use and regular mental health items. So we didn't really have a comparison to know whether this is a high usage or a low usage. When we looked at heart, stroke and vascular health in the hospital and ED data, we didn't find consistent patterns, but there were some examples of increases of services coinciding with or following poor air quality, suggesting more analysis is needed. Sorry, Mike. Gone. Visits to GPs, for some areas there were increases, but in others there were substantial decreases in fire affected areas. So we think this may suggest that people were heeding public health advice to stay indoors and reduce their exposure to smoke. And then for burns, there were some increases coinciding with intense fire activity. For example, in the week beginning the 15th of December, there was increased fire activity in South Australia with the Cuddly Creek fire and the Duncan and Menzies fire on Kangaroo Island. And from the South Australian inquiry, we know that 51 firefighter injuries resulted from the Cuddly Creek fire. So application of this work, we hope that it can be used to identify areas or populations of particular vulnerability in future bushfires and understand the likely health impact. We're exploring the possibility of developing finer resolution data for researchers to analyse because health data isn't at its finer resolution as most environmental data. Across the disciplines, it would be better if we could get it down to daily data, which is very difficult with privacy and confidentiality considerations. We think that further analysis of heart, stroke and vascular conditions should be done, taking into account things like heat as well, which is very hard to decouple from smoke during a bushfire. Further analysis of death data once the register data is available, and other outcomes for perinatal priority populations such as perinatal data. Long-term outcomes, there's some research around, but not a lot. And we think that the use of data linkage could help with looking at long-term outcomes for people who were affected by fires and identifying indicators for environmental health that are reported consistently at a national and subnational levels. So I'd just like to thank my team in particular. There was a lot of work went into these two reports, and the funders and data providers. Thank you.
Thank you so much, Claire, and a lovely presentation about, timely access to data to actually demonstrate the impacts of climate change on human health. Thank you so much.